Facts about IUI. IUI or intrauterine insemination is the procedure where the sperms are placed directly inside the uterus. So normally during penovaginal intercourse, the sperms are deposited in the vagina. If this happens around the time of ovulation, the sperm climbs up through the uterus and it goes to the fallopian tubes where the eggs will be waiting, and this is where the sperm fertilizes the egg to form an embryo, which grows for about 5 days, comes to the uterus, sticks and grows as the baby. So one common question which normally couples ask is, what is the success rate of IUI? It is no miracle or no magic that we are doing. It is just that we are ensuring the presence of the sperm in the genital tract when the eggs are there. So we monitor the growth of the eggs in the ovary by doing scans, and at the time that it is most probably going to be released or ovulation is going to happen is the time we plan an IUI. So we inject the sperms into the uterus, but beyond this the sperms go and meet the egg and they form an embryo in a natural manner. Naturally, in 1 month, everybody does not get pregnant. The chances of success rate with one cycle is 10%. When you do an IUI, it's around 15 to 20%. The next important question is, can I manage work while undergoing ovulation, induction and IUI? Yes, you can definitely manage work. It is not that you have to stay in the hospital. No hospital admissions are required. You need to visit the clinic first on day 2 of your cycle, followed by about 3 to 4 visits to monitor how the eggs are growing, where you will be undergoing a transvaginal scan, and your doctor will monitor the eggs which are growing and accordingly give injections to grow the eggs. And once they are mature, they will plan for an IUI. You will have to come to the clinic with your male partner and then undergo the process of IUI. The male partner is expected to give sperm, and we do a sperm processing where the abnormal sperms, the immotile sperms are separated from the good sperms, and they are concentrated and injected directly into the uterus. The next question which most of the couples have is my baby going to be alright after I undergo all this? Yes, definitely. We are not doing anything to the genetic makeup of the baby. What a baby is mostly due to the genetic makeup. So since we are not affecting the genetics of the baby, there are not increased risk of abnormality in the baby compared to natural conception. So all we are doing is we are facilitating the egg and sperm to meet to form the embryo. So the chances with natural conception for an abnormal baby is 2 to 3%, which remains the same for an IUI. So IUI definitely helps couples in certain situations where there's mild male factor infertility, or when we have to go for donor sperm IUI, or there are definitely problems in the egg and sperm meeting or problems with intercourse. However, there are certain factors like tubal factor when the fallopian tubes are completely blocked, or severe male factor infertility where the sperm count is so low that you may not be able to undergo IUI.